I'm a manager for patient registration at a hospital. As part of my job at the time, I would have to visit patients to advise them how to plan for their discharge in the event that they're not able to go home. I went up to the unit where he was an inpatient. I found his bed number. I went into the room and discovered that he had tried to strangle himself. I called for help. I tried to assist him removing the ligature from around his neck. And as I was doing that, the code team rushed in. So I didn't have a role at that point because the healthcare professionals needed to access and they needed to do their jobs. And so I left with this vision of a person who had just tried to commit suicide in front of me. I was kind of left to work it through on my own. Thankfully, I have colleagues and friends that in healthcare as well who were able to offer some perspective and some advice. My director at the time, of course, she asked how I was, but she was more focused on the patient and how he was doing and giving me updates as to his progress. And she should have been focused on the patient. Of course, I wanted to know that he was okay as well. But directly in terms of how I was coping or how I was feeling, I did not receive any direct support. Nor did I look for it other than talking to people who I trust in my circle. I think during that time, I would have needed a bit more support, given that I'm, again, not part of the clinical care team and not necessarily trained to manage these types of crisis situations. It probably would have been helpful at the time for me to speak to somebody to get some perspective on how and why these things happen and how people cope with seeing this sort of event take place in front of them.
I've been working as a nurse since 2004. There was a time when one of my patients needed a chest tube to be inserted at the bedside. And the physician at the time had asked me to come in and to assist him with the procedure, but I ended up drawing up triple the dose, and the patient ended up pretty much almost dying there. So his respiration started to slow down, his heart rate went down. I was like so scared because all I could think of was that my patient was going to pass. And I remember walking out of that room feeling so embarrassed, and no one said, you were okay, like it happens, it's a mistake. It was like, it just happened and you document. I think for me, when I left work and then came home, you essentially, you can't go to bed right away. You think about it, you think about what you could have done differently. I remember going home and at the time telling my husband, like, I made a mistake, and it's not the same because your family and your friends, they're not healthcare providers, so they don't really understand the impact. Like, it still goes on through your head and you just don't have that, like, again, reassurance. It's a different type of support that you need. I remember I didn't sleep, and all I could think of is I gotta go back to work and I have to face those same colleagues, I have to face my patients, and it just left me feeling like I wasn't good enough, like I wasn't smart enough, and maybe this wasn't the right profession for me.
I'm a general surgeon, and I've been in practice since 2006. I've experienced trauma from adverse events, and I guess it's a little bit to be expected when you're dealing with life and death. This was during my training. I had to work in the ICU, and I was looking after a patient. And to make a long story short, the patient was very sick and required a lot of attention, etc. And in the ICU, this was a patient of another surgeon. And come the morning, that vascular surgeon was not happy with the way I dealt with his patient. So this was quite traumatizing for me because obviously, as you're doing your best and you're in your training, you try to help people, and the last thing you need to feel is subjected to this kind of verbal abuse. I was quite distraught by all of this, and what shocked me at the time was that not only the experience that I had to go through, but when it came time to turn to people for help, naturally the people I turned to were my immediate supervisor, who basically sort of shrugged it off and said, "Don't worry about it, he can't really do anything." And then when I went to my program director, his advice at the time was, "Oh, just relax and go have a beer." I guess what I would have wanted to have heard is a little bit more of a sympathetic ear, maybe a safe place to talk to other individuals who've undergone certain similar circumstances, etc. Maybe being in a place where you can talk about these things freely and not feel like you're being sort of isolated or singled out and being made to feel inferior or inadequate.